Is VATS a good option for COPD lung reduction? Imagine being able to breathe easier and move around more comfortably. For some people with severe emphysema, a special surgery called VATS can make that happen. Video-assisted thoracoscopic surgery, or VATS, is a less invasive way to perform lung volume reduction surgery. Instead of big cuts, surgeons use small incisions and a tiny camera called a thoracoscope. This helps remove damaged parts of the lungs that trap air and cause breathlessness. Compared to traditional open surgery, VATS has some clear benefits. The recovery time is shorter, and patients often leave the hospital sooner. Studies show that the risk of dying within 90 days after surgery is similar for both methods, making VATS a safe choice for many. Patients who undergo VATS are more likely to be able to live independently within a month after the operation. Plus, their lung function and ability to exercise tend to improve, just as much as with open surgery after 1 or 2 years. Another advantage is cost. Because VATS involves less hospital time and fewer complications, it usually costs less overall. Some hospitals even use a version called non-intubated or tubeless VATS, which avoids putting a breathing tube down the throat. This can reduce complications during surgery, especially for patients with emphysema. However, not everyone with COPD is a candidate for VATS. Usually, patients with severe emphysema and significant lung hyperinflation are considered. They should have stopped smoking and tried medications and pulmonary rehab first. Sometimes, surgeons prefer doing the procedure on just one lung instead of both, because it means a shorter hospital stay and less need for breathing support afterward. It is important to remember that lung volume reduction surgery, including VATS, is not a cure for COPD. It helps improve symptoms like breathlessness and makes daily activities easier. The decision to do VATS depends on the patient's overall health, lung condition, and how well they respond to other treatments. When chosen carefully, VATS can be a good option, offering a safer, quicker recovery and meaningful relief. The choice between doing one or both lungs depends on each person's specific health situation and surgical risk.